delighted to see this day, and I have to comment on the complete hypocrisy on display from both Senators Keoghan and Mullen, who've now left the chamber. Sorry now.
No, to be fair,
things go both ways
No, sorry.
Yeah.
We're not going to have a reenactment of yesterday. to be fair, both senators expressed their apology. They had to leave because they have another engagement, and we shouldn't.
That's fine. I wasn't commenting on why they've left.
We shouldn't comment on members who are not here either.
I'm going to speak to what's just been spoken about. So Senator Keoghan mentioned that people will no longer be allowed to stand silently. Senator Mullen spoke about there's no issue, nothing's happening outside Cork, and yet I have in my hand here a tweet from said senator saying, "I encourage people in Ballinasloe and the surrounding area to engage with medical and other staff to discourage the practice of abortion and to never let up." A tweet. We know the damage that social media does, and we now have a senator going out on social media encouraging people to stop medical staff, to interfere with staff in their lawful carrying out of services in this country. It's an absolute outrage. It's a disgrace that any politician would do that to staff going about their business. Yes, we did have a referendum and not everybody voted in favour, but this is the way laws work. You vote, you take it on the chin, you don't get what you want, the laws are passed. Now, I have to say, I am encouraged by this piece of legislation. Unfortunately, only 1 in 10 GP practices do engage in allowing women to have abortions, which is their legal right. I'm also delighted, though, to say that Ballinasloe in Portiuncula Hospital, as of last week, has started to allow women in Galway to have abortions at their hospital. I'm absolutely thrilled with that news. We have to do an awful lot more. I think this bill will give some comfort to medical staff. I'm hoping that more and more doctors in some of the counties around me in Midlands North West, we have some of the lowest abortion rates, and the reason for that is not because women don't want abortions, it's because they have to go somewhere else. Only 3 GPs in some of our counties, Sligo, Roscommon, Mayo, huge areas of the country, and people cannot get access to services. So we pat ourselves on the back as a country saying, well, you now don't have to travel to England. You shouldn't have to travel anywhere to get a medical service that you're entitled to under the law. It was, as you said, Minister, and as Senator Clifford Lee and Senator Conway have said, it was supposed to be brought in along with abortion in the country. I know the amount of work that the officials have done in your department to get it to this point, and I just want to say that you know, there's been nothing but support in terms of getting this piece of legislation over the line. I'm one of 12 senators who signed a piece of legislation. I want to thank Senator Gavin as well for doing such work on a cross-party basis, and I know that Together for Safety are here in the gallery, and just to thank them as well for all of their work, because that's what pushes things on. It's that kind of activism that motivates a government to take the next steps. I think it's important as well to mention that it's not just about provision of abortion services, but that's what we're here to talk about. But here's all of the other things that we've done as a government, and one of those is the expansion of free contraception schemes. So that was something that we also put into the programme for government, and Minister Donnelly has taken the steps and has provided that money so that, yes, you can get an abortion, but you can also ensure that cost is not a barrier to contraception. And that is massively important. And I know that it was one of the recommendations that when you bring in abortion, that you also ensure that there's that follow-up care so that people don't feel that contraception is a barrier for them in future. There has also been the elimination of VAT on period products. There has been 10 million for publicly funded IVF treatment. There has been, the VAT has been taken off HRT for menopause, which, as you know, Minister, I'm hugely passionate about HRT because women of all ages need treatment. I also believe that it's a very small cost to provide free HRT, so I'm going to keep pushing on that, and hopefully we will have success in that. And of course, the expansion of phased expansion of the complex endometriosis service in Cork. the almost 1 million investment to develop women's health hubs, and additional funding for the numerous other things. But I'm not going to mention them all because they're too numerous. But I do think that what we have seen under this government is a real dedication to women's health, and long may that continue. Hear, hear. And this piece of legislation is a really, really important part of that and that work that is going. So I just want to thank you again, Minister. I'm delighted to be here on this really significant and important day. Thank you.